We're back here with Dr. Mason and Jackie, and you're a miracle worker. It's an ongoing miracle. So I've got my fast twitch back now.
Look at that.
Isn't that unbelievable? I can type again.
Excellent.
I'm better than before. So it is like
Wonderful.
such a miracle to kind of no loss and then have this regained.
Good.
And I think that proves pseudo-progression.
Yeah, I agree. So it does to me too.
Yeah.
Because if it was true progression, we might have gotten back a little something,
Yes.
but not like this.
Yeah,
So this was inflammation. This was edema. This was pseudo progression, and so excellent.
And I'm doing push-ups now as well. I'm back
Yeah.
to doing push-ups. It's just extraordinary.
And your legs are fine.
Yeah, legs are fine.
Speech is fine.
Speech is fine. Everything.
Memory is pretty good.
Yeah.
Excellent. And you're on 24-day 6Q6 right now.
6Q6.
Of the dexamethasone.
Yeah.
And you've got an Avastin coming up.
Yeah.
And then we've got the temozolomide coming up.
Mm-hmm.
You're off the Optune, obviously, for now.
Yeah.
And so I guess the next question is, when do we start to lower the steroids?
Yes, I'm enthusiastic. I would love to review my labs. So.
Your labs were remarkably unremarkable.
Oh,
I was
I'm
actually very
sorry.
pleased. Your chemistry panel was fine. Even your glucose was 115,
Yes.
which I thought would be higher given the amount of steroid you're on, but it's not. So that's great.
Well, I'm relieved,
Yeah.
partly because I think I'm on the metformin,
Yes, I think so too.
and
Must be that.
and what I'm relieved by is that there's a synergy with the chemo,
Mhm.
and I was concerned that
Yeah.
that would
Yeah.
have an impact on my white blood count and
No, your
platelets.
white blood count's great. It's 10.3. Hemoglobin's 14.4. Platelets are 188. Chemistry panel was normal essentially. So these were great numbers.
So what I noticed
Mhm.
is on my urine. You did a baseline urine,
Mhm.
and I was spilling protein into.
Yeah.
And I think that's what I'm feeling is that the steroids are breaking down my muscles. I'm having,
Well, that would be typical of this type of steroid,
Yeah.
as you know, and especially at the dosage you're on.
yeah.
So,
So that's the big discussion.
Yeah.
How fast can we take,
Yeah.
given that we're on the Avastin that's
Right.
going to starve
yeah,
the cancer of its blood supply and actually
Yeah.
decrease the edema.
yeah.
How fast can we go safely?
What size dexamethasone pills are you using?
We're using 1 milligram.
They're all
tablets.
ones. I would probably, I don't go too fast because you
Yes.
could rebound. So you're taking 6Q6 now. I would probably drop it to 4Q6.
Ah, okay.
Yeah. And let's just leave it there for a couple of days and see how you feel. If
Great.
there's any exacerbation of your symptoms, then we can always go back up again, but I don't think there will be. I would just peel it down from 6Q6 to 4Q6.
Oh, that's fantastic.
What does that mean for
So
Q6?
4 milligrams every
milligrams
6 hours
every
instead
6
of 6 milligrams. And so I would do that and then just see how you feel.
Yeah.
And then we'll do that for several days.
Yes.
And then if you're doing well, we'll peel it down again.
Okay.
Probably not quite that fast, but
Yeah,
yeah.
I like that.
Yeah.
I was hoping for that.
Yeah.
Um,
I think you're ready. Given the excellence of your exam,
Yes.
and the fact that you're on the Avastin, I think you're ready.
Okay.
I think this is the Avastin. I really do. Steroids are great, but I rarely see this kind of an effect from steroids alone. So I think it's probably the Avastin plus some time too.
Yeah.
Yeah.
Oh, it's.
Yeah.
I'm so happy about that. Because maybe I can get some good sleep in the middle of the night.
Yes. So what we'll do is we'll go down on the steroids like we just talked about, and then for the next move we may go to Q8 rather than 6,
Yeah.
or even 12, so we can get you some sleep in the middle of the night.
Right.
Yeah.
Okay.
Yeah.
Brilliant. So my next high dose chemo is the week of, well, the next infusion of Avastin is on the 17th.
Yeah.
And the next high dose chemo week is the 22nd through the 26th of March.
Mhm.
Yeah.
And what I would like to do is I would like to restart the Optune on the 21st.
Okay.
And there's a reason for that, and I would love to, share with our viewers that the challenge of this cancer is that there is some modalities work in replication phase, and some modalities work in resting phase.
Right.
And the challenge with, so for example, the radiation therapy causes damage to the cells in resting phase, in replication phase. But it doesn't affect the resting phase. My understanding is that temozolomide gets at the resting phase.
Mm-hmm.
And the Optune theoretically puts everything on pause and puts more of the cells into resting phase. So
Exactly.
theoretically, I should get a synergistic benefit during that.
Theoretically
Optune.
true, correct. Yep. And that's why
Yeah.
they're used in that phase after the combined modality together.
Yeah.
Exactly right.
So I would love to test, I know it felt like there was coincident, there was a lot going on
Yeah.
at the time. So I think if I started on Sunday
Yeah.
and there's no
Yeah.
worsening, I will continue through the week.
I was thinking about that this morning actually, and I think that the Optune probably did not cause this.
Yes.
I think this was just going to happen. I think the reason the Optune is sometimes associated with this is that that's when we use Optune, and if this is going to happen, that's when it occurs.
Yeah.
So I think it's probably not causation. There's a correlation, but
Yes.
it's not causation. So
Yeah.
I think I agree. We'll be cautious, but I think you can go ahead and start now.
Okay, fantastic. And then I wanted to update the record that I'm fully vaccinated now.
I heard. Yes, very good.
Yeah.
Excellent.
And then the
Yep.
final thing I've got on my list is, it's important to talk about advanced directives, and we filled out our advanced directive for
Yep.
scanning and inserting the file. This is the important time to talk about while you can.
Yes, exactly. Yeah, very much so.
Yeah.
Good. So you're doing great.
Yes.
No problems with thrush from the steroids.
No,
Quick peek there. That's fine. Absolutely fine. Good. Excellent.
oh, it's a miracle.
Yeah.
A miracle.
Great.
Oh, I
right.
so love and appreciate you.
So I think we'll see you back in a few weeks to see how things are going.
Yes.
Stay in touch by phone though regarding the tapering of the steroids. So let's
Yes.
go down on it now.
Yeah.
And let's kind of leave it at that at 4 every 6 hours for let's say 5 to 7 days.
Yes.
And then we'll try to take it down again from there. Okay?
Fantastic.
What should I be looking for in terms of
Any
like
recurrence
what's
of the symptoms.
okay? So any
So,
symptoms like
any-
getting
so
worsened.
Worsening, exactly. Problems with speech, and you would obviously appreciate if you're having any difficulty with your hand or dexterity. That's what we'd be looking for. Basically, a recurrence of what we had before,
Okay.
Yeah.
but not that severe.
Yeah,
So
we don't want to let it go
actually-
like
Exactly.
that.
Yeah.
What the most sensitive marker for me is the way I type.
Yeah,
on my
I think
iPhone.
so. I think that's what you might notice first, if
Yeah.
something was moving in the wrong direction.
Yeah.
All right. Outstanding.
Oh,
Great way to end my day.
outstanding.
Yeah,
Right
thank
on.
you.
Right on.